I had the Prader-Willi Syndrome. It's the result of an abnormality on chromosome 15. There are three ways that this can happen. In many cases, there is a deletion of critical genes on the portion of the fifth chromosome, normally contributed by the father. In most remaining cases, the entire chromosome from the father is missing, and there are instead two chromosome 15s from the mother. In less than 3% of cases, there is an imprinting mutation on chromosome 15 contributed by the father. The genetic material is present, although inactive. Symptoms of this syndrome change over time at birth and as infants. Individuals will have poor muscle tone, are floppy, and may be considered failure to thrive. They often have a weak cry, difficulty sucking from a bottle or latching to breasts, and frequently require tube feeding. Muscle tone and strength generally improve with time. However, motor milestones are often delayed. During childhood and beyond, individuals lack normal hunger. They often are unable to control their food intake and need close monitoring to prevent overeating. Food-seeking behaviors become common but vary in onset and intensity. With lower metabolic rate than normal, if left untreated, the combination of problems can lead to obesity or related complications. Individuals with this syndrome usually have measured IQ scores ranging from low normal to moderate intellectual disability. Those with normal IQs tend to exhibit learning disabilities. Other symptoms include growth hormone deficiency, small hands and feet, scoliosis, high pain tolerance, speech apraxia/dyspraxia, sleep disturbances, and behavioral changes. This is a spectrum disorder, and all symptoms vary in severity and occurrence. Testing this syndrome, usually using a series of specialized genetic tests. Common chromosome tests, such as karyotype, do not reliably detect genetic changes of this syndrome. Genetic testing for the syndrome can be expensive and may require sending blood and saliva samples to specialized laboratories. This test detects more than 99% of the syndrome. All three genetic subtests of Prader-Willi syndrome have a positive DNA analysis for the syndrome. The FISH test can be used to determine if the subtype of Prader-Willi syndrome is deletion. However, it will not detect the other two subtypes of Prader-Willi syndrome. Therefore, it should not be used as the first genetic test. Chromosome microarray testing can be used to detect the chromosome deletion. Treatment for this, there's no cure. Tube feeding and other special feeding techniques for those that have feeding difficulties. Some infants have trouble getting their eyes to focus, so treatment of eye problems. Orthopedists treat the scoliosis if that is present. A sleep study or treatment such as like a CPAP would be helpful. A human growth hormone was approved by the FDA in 2000 for patients with Prader-Willi syndrome. Research indicates that HGH is not only effective in increasing stature, decreasing body fat, increasing stamina, and bone mineral density, it has positive effects on development and behavior. Many individuals with this syndrome participate in a variety of therapies, including physical, occupational, and speech therapies. Treatment at home would be supervising the diet, physical exercise, and the prognosis is a normal lifespan, but just lifelong support to achieve independence is the goal.